The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.
And I'm living local. I'm living local 'cause it's where I love to be.
Welcome back to Loving Living Local. I'm Gretchen Wirtz, and today we're getting healthy again with Solvera Health. We have a new face joining us. We've got Robin Henry, their Chief Population Health Officer. We'll talk about that in just a moment, but thank you so much for being here.
Thank you for having us.
So tell us a little bit about your background and your role here at Solvera.
Sure, happy to. My background is I am a registered nurse. I have been for 18 years. It is my first language. I have collectively served much of our aging population around Peoria. Helping with OSF healthcare predominantly and under our home care umbrella. So I helped with any transitions of care that was needed from our patients leaving any of the hospitals into that post-acute setting, nursing home, home health, hospice, anything that they needed to make it safe.
Okay, so that's your niche, that's your, your focus. So population health management, what does that mean and what are you doing in that role?
Absolutely. Everybody tends to see population health differently. The way that Solvera Health views population health is really by scaling that triple aim. And by that I mean the experience for that patient as we are helping our population that we serve maintain health and wellness, but also while we're trying to help reduce overall cost utilization to the healthcare system.
Okay, so how do you go about doing that? What's your plan for it?
we have a lot of programs that we've instilled. For example, chronic care management. So when we identify that a patient that we have who is a Medicare beneficiary, so over 65, has 2 or more chronic conditions, we're able to touch them remotely, virtually, upon twice a month and make it where it's that meaningful and impactful, engaging conversation that just becomes a natural flow into their care, and being able to process these interventions before that needed acute stay or before that ER presentation. We're able to bring them into the clinic or help them really just maintain what this episode of care looks like. And then we also manage by remote patient monitoring. So we have like blood pressure cuffs, their finger stick blood sugars, their weights, and we're able to bring that in.
It comes right to you guys then. Wow, that's amazing. That population can work all this technology. That I have to ask because that could be a little overwhelming and daunting.
It very much can be. We're there to help them every step of the way, and we do have that IT support. And they receive the modules,
the stuff,
as Solvera Health. Correct.
And then it comes right there. That must make things a lot. It's got to take it, make it not as overwhelming when they do come in for those appointments in person and everything, like to kind of have that monitoring all along.
And that is a part of what we do as well. We do have more frequent visits, but they're at shorter segments.
Right.
So they still have those touch points with their providers.
Okay. And by communicating you're just on the phone with them?
We're on the phone, and with like the remote patient monitoring, it does feed into the electronic medical record.
Nice.
It is, and it provides those alerts in real time if a blood pressure is too high. So again, it allows us to have the opportunity to really step in before
it gets too bad.
Right.
Something gets really bad. So the feedback from the senior, it must be amazing. They must love this more contact, I guess.
What the calls that I hear that I step in with our care coach team is they do. It is very impactful. They get to where they understand, they know that schedule, and they recognize that voice, and it does become that caring atmosphere, and it allows us to really focus on their health as well as that wellness and not just so much as that disease, and make it where it's not a negative experience.
Well, that sounds perfect. That's great. I love that. All right, so if you want to learn more about Solvera Health, you can go online, of course, to solverahealth.com. You can call them at the Peoria Clinic, 855-476-5837. You can find them on University. They're doing great things over there. They can answer all your questions. And Robin, thank you so much for being here, and thanks for joining Solvera. And this is going to be great what you guys are doing over there. Thank you so much.
It is. Thank you.
All right, we've got more coming up. Keep it right here.
I'm living local 'cause it's where I love to be.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.